Upstate Medical University in Syracuse, New York, invites you to Be the Informed Patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Brain fog and extreme fatigue are two common symptoms of long COVID, but there are many others. Physical therapy has emerged as a crucial aspect of managing patients with long COVID. Today, I'm talking with Doctor of Physical Therapy, Kira Dahl, about what this involves. She's from Upstate's Department of Physical Medicine and Rehabilitation. Welcome to the Informed Patient, Dr. Dahl.
Thank you, Amber. It's great to be here.
Now, to be clear about what long COVID is, this is when symptoms linger after a person is no longer contagious with COVID. Is this weeks or months? How long is long COVID?
It depends on what you read and it depends on who you're listening to, but generally it's accepted to be about 12 weeks after your original infection with COVID. If you're still having symptoms, about 3 months later, you start to be classified as a person with long COVID, which currently the words are being used as post-COVID syndrome as opposed to long COVID.
Post-COVID syndrome.
Post-COVID syndrome.
Do we know what percentage of people who are infected with COVID end up with post-COVID syndrome?
According to the CDC from 2022, it was about 7%. I definitely think that number has changed at this point. And there are sources that say anything from 3% to I've read 80%, which seems unreasonable. But the numbers are changing constantly. Everything is changing about post-COVID syndrome. So the CDC currently says 7%, but I don't think that's completely accurate anymore.
Well, what about those with post-COVID syndrome? Is it more male or female, older, younger, those who were vaccinated, those who were not? Is there any characterization you can give us?
Again, depending on what you read, it's kind of all over the board, but it is pretty consistently accepted to be more prevalent in females. Most sources do say the older population. However, the CDC's website does say, I can't remember the exact range, but it's like 35 to 49-year-olds. But pretty much every other source says it is more prevalent in geriatric patients, anybody over 65. Definitely the unvaccinated population originally was showing more post-COVID syndrome. There aren't that many people anymore who aren't vaccinated, and there really are not a lot of new cases of post-COVID syndrome, and they kind of think that might have to do with more people being vaccinated.
So among the patients that you and your colleagues care for, what are the most prevalent symptoms? We mentioned fatigue and brain fog. Is that the
Yes.
number one?
I'm going to say it again. It depends. Post-COVID syndrome is so broad. It's such a broad spectrum. It doesn't even have a good definition. Basically, it's just symptoms that you have that you did not have pre-COVID. It can be cardiovascular symptoms. It can be pulmonary symptoms. It can be psychiatric symptoms. It can be dermatological symptoms. It is truly all over the board. I personally work with the pulmonary group here at Upstate, which is where we started to get referrals for post-COVID syndrome, because initially people were coming in with respiratory issues or lung issues following their hospitalization or their bout of COVID. That has decreased significantly. And so now when we're getting referrals for post-COVID syndrome, they are primarily people with the brain fog, the fatigue, sometimes POTS, which is like an orthostatic issue where people get dizzy. They're not able to tolerate exercise or even upright positions sometimes. We get a lot of referrals for those. But again, truly, we're not seeing the numbers of referrals that we originally were.
So why do you think that is? Are people getting better on their own?
There are a lot of different theories about this. When we do get referrals currently, this is anecdotal. This is just what I'm seeing. Those patients had COVID in 2020, 2021, maybe 2022. I don't know if it has to do with the current strains of COVID, but we're not seeing any referrals for actual post-COVID syndrome from anyone who had COVID in 2023 or 2024.
So those that came for help rebuilding their fitness or their stamina, were you able to work with them and see improvement? Does physical therapy actually help those people?
It depends on what their symptoms are. and whether or not they have true post exertional malaise symptoms, which we can probably talk about in a little bit. But the post exertional malaise that is most frequently seen with chronic fatigue syndrome is a common symptom found with post COVID patients as well. And those patients are handled slightly differently because it's not just deconditioning. They're not just out of shape. It's not just that their fitness is decreased. It is truly a physiological change in their ability to tolerate exercise, activity, even like daily life. So those patients we treat with education primarily. We're teaching them activity modification techniques and energy conservation techniques, and really just teaching them to live with their new symptoms. Because if we're basing what we know on what we know about chronic fatigue syndrome, those patients are unlikely to improve. So those patients we're treating with education. All of the other patients that we get referrals for, we treat what they're coming for. So if they do have pulmonary issues, we put them through a course of pulmonary PT and they absolutely improve. If they're coming with dizziness, we'll often refer them to like vestibular therapy or possibly for an eye exam. We also do a lot of referring to occupational therapy for things like brain fog, difficulty concentrating.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Doctor of Physical Therapy, Kira Dahl from Upstate, about recovery from post COVID syndrome. I heard about research published earlier this year where scientists in the Netherlands took biopsies or samples of muscle tissue from post COVID syndrome patients before and after exercising. This was published in the journal Nature Communications. Can you discuss what they found?
It's got a pretty small sample size. I think they looked at like 25 patients with post COVID syndrome, but it is very interesting. They found basically that the patients were actually having issues with their skeletal muscle, that the problems that they were having with the fatigue was not actually coming from a more centralized, like a cardiac issue or a lung issue. It truly was a problem with the skeletal muscle itself, which is really interesting. And what I would actually be interested in seeing is that compared to patients with chronic fatigue syndrome, because that article and that study was specifically looking at patients who get that post exertional malaise, which again is traditionally seen in chronic fatigue. So I'd be interested to see if those muscle biopsies were similar or the same.
So is this like muscle fatigue after you do a big workout or you are very active in the yard work one day and your muscles are really sore the next day? Is it like that or is it something different?
No, it's completely different. It is an actual physiological change in their ability to do exercise. And it's interestingly not that well understood for how long it's been studied in the chronic fatigue population. It essentially means when people have post exertional malaise, they one day can do exercise, they will get tired, but then they crash. Not they get kind of tired and they can still go about their day and they can go to work and they get kind of sore. Their body just crashes. And I mean, it can last up to weeks. It's usually days longer than a traditional person who just over exercises, which will recover within 3 days or so. These people will be kind of down for the count, not able to do anything for days and days and days, up to 3 weeks. It's something completely different.
So what is recommended in terms of physical activity for people who have lingering COVID symptoms?
It depends on the symptoms. Recently, the referrals that we do get seem to be more for what's called deconditioning, as opposed to post exertional malaise, which is not treated with exercise. Exercise is contraindicated for that. People who have deconditioning are basically out of shape a little bit or just like lower than they normally are from being sick, from being in the hospital, from inactivity. And those patients do tend to respond very well to just a pretty basic exercise program with vitals monitored. We monitor their vitals, make sure everything's going okay with their heart and their lungs. But generally, those patients do very well.
Someone who has recovered from COVID at home, at what point would they consider seeing a physical therapist?
Generally, that is recommended by their physician, unless they have some kind of history with physical therapy. People with post COVID syndrome are generally not seeking it out anymore. In 2022, when post-COVID syndrome was much more frequent and also less studied, not as well understood as it currently is, people were scared and people were not listened to a lot of the time. People felt very alone and lost. So they were seeking out care on the road. A lot of the referrals came from people who found internet sites and different Facebook groups that would recommend trying therapy. So, what I would say for somebody recovering at home is if you're not continuing to improve. So, if you're just under the weather, you get better, but you're not 100%, and you're able to kind of every day feel a little bit better, you're probably fine to stay not coming to physical therapy. But if you don't find that you're improving over time, or if you're getting worse, I would talk to your doctor and then maybe even just come in for a consult. We do a lot of those.
Well, Dr. Dahl, thank you so much for making time to talk about post-COVID syndrome. I appreciate it.
Thank you so much for having me.
My guest has been Kira Dahl, a doctor of physical therapy at Upstate, working in physical medicine and rehabilitation. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe. Find our archive of previous episodes at upstate.edu/inform. If you enjoyed this episode, please tell a friend to listen too. And you can rate and review the Informed Patient podcast on Spotify, Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.